Hmm. Yeah, every time like I said, get on here, my hair is a little grayer, a little older. I don't think going to med school in your 40s is helping you with your gray hair anyway. So I'm trying to get the screen. I'm gonna have to turn it probably. It doesn't want to let me go live that direction. So I guess just prop it up that way. So yeah, today's it's the big day for my New Mexico Lobos. They're going to be playing in the round of 32 against Michigan State. They got the upset against Marquette on Friday, so that was pretty awesome. Um, yeah, yeah, we're jumping back on here another live about med school as a chiropractor. If anybody has any questions or wants me to get into any detailed topics, I think we talked like a lot last time about like some of the differences in the school, and then some of my experiences going to a Caribbean school. For you guys that don't know, I go to St. James School of Medicine, uh, based out of Chicago, but you do your offshore education, your basic sciences in St. Vincent in the Caribbean. So get a little bit of out of America experience, so that's kind of cool. And then you do your clinicals in the United States. That way, you're ready to go for residency. You have experience in the U.S. medical system, et cetera, et cetera. So one of the questions I'd gotten before was kind of talking about the differences in education, and I kind of got into that last time a little bit. Like um, the basic sciences in chiropractic school and med school are fairly, the topics are fairly similar. Like obviously there's like a lot more anatomy in chiropractic school. I think we had 4 or 5 different anatomy classes, including radiological. Um, so the pace is a little bit slower in chiro school. Like I said, you're ending. I was in class almost to the end of the third year. Where in med school you only have 2 years of basic sciences in the classroom, and then you go into clinicals. And then the big difference is really the two biggest differences is this. Like in the curriculum, the USMLE questions are tertiary questions. So it's not enough to just memorize like one fact. It's you need to know. It'll ask you a question and it'll ask you like you'll be like, ooh, I know something about this. Then you'll need to know the mechanism of it. Then you'll have to know like which other disease has a similar mechanism. So the questions are just a lot. You have to have a lot more mastery to answer the questions correctly on med school exams compared to chiropractic school exams. Where a chiro school exam might just ask you like, what's the nerve that innervates, pick a muscle. So that's one of the differences. The biggest difference in the two educational formats is in the clinical experience. So in chiropractic school, the clinical experience, whether right or wrong, is just it's really lacking as far as a healthcare professional's clinical experience. There are a couple exceptions, like if you get to work in the VA hospital, you'll get some real clinical experiences. But even then, like the types of patients you're dealing with don't really have severe medical conditions that you're treating. Like if you go there, you're just working in collaboration. So you're basically working underneath or alongside physical therapists and physicians who are sort of dictating the care that you're giving. So you're not really having to make decisions on your own, which is kind of good in a way. Like that's what attendings are supposed to be doing. But if you're not in those, if you're in the outpatient clinics in chiropractic school, like where I went to school, we had some hand-me-down patients because you have to get X number of reps in, right? Like if you've got a bunch of physical examinations, you have to do a bunch of adjustments, you have to do a bunch of physiotherapeutic interventions, and they have to be watched by your supervising doctor who has to tell you that you're doing them correctly, that you're competent, that you're adequate at doing a physical exam of doing adjustments. The thing is, though, is we end up having to get our own clients, our own patients for outpatient clinic, or we're getting patients that are patients of the clinic that are being handed down to us. So by and large, the vast majority of those are going to be people that aren't really sick. Like they don't have severe injuries. They might be friends that we've met out in the community. They might be family members, or they're just chiropractic wellness patients. So unfortunately, when chiropractors get into clinical practice, when they first see disease is the first time they've seen disease. So the first time somebody walks into their office with a fracture or with some of them are coming in with strokes or things like that. Like a chiropractor might not be able to recognize that when they get into clinical practice because they didn't see those cases when they were in clinicals during school. And they don't have an attending now because the vast majority of them will go into their own practice or they'll work underneath another chiropractor. Whereas in medicine, you're going to get 2 years in the hospital observing like really sick patients, people that are dying. You're going to be doing rotations through medicine, through surgery, through OB, through psych. And then after that, in order to practice as a doctor, you have to go to residency. And so in residency is really where doctors learn how to be doctors. So they get 3 to 7 years of supervision, so where they're seeing sick patients, but all their cases are having to be reviewed by an attending, or a program director, the people that are basically teaching them how to be a doctor and how to manage certain types of cases. So they're getting hands-on experience with actual sick patients. And I think that's one of the reasons that, doctors are a little bit, when they get out there, a little bit more careful as well. Obviously, there's more competence to be gained from that side of oversight. Now we're comparing apples and oranges. Like, nobody's expecting chiropractors to treat disease or severe disease. They're supposed to be treating musculoskeletal pain that's non-surgical. But the thing is, how do you recognize what's supposed to be surgical or non-surgical if you haven't had the clinical education that can help you do that? So there are chiropractors, obviously, that get extra education, that they go out of their way to really learn the literature, but there are some that don't. And I think that in itself is like the biggest clinical difference. Obviously, the scopes of practice are wildly different. So you'll see, you'll see posts out there, comparing chiropractic education and medical education. They're so wildly different, they shouldn't even really be compared, to be honest, other than like some of the basic sciences are similar. Like, if you wanted to compare chiropractic education to something else, it would probably be like physical therapy or occupational therapy. And in that case, I would say that chiropractic is like a little bit more intense. Obviously, I know a lot of physical therapists. The chiropractic education is modeled after med school for the basic sciences. So there's more exams. But again, I think PTs and OTs get actually like a lot better clinical experience because, again, they're working in the system, they're working in the hospitals, they're working in outpatient clinics, so they're seeing real disease. So I think that PTs, they get better education where it really matters than chiropractors on average. Like, I'm not here to crap on chiropractors, but, I think it's, you don't know what you don't know. And for a lot of chiropractors, they just know their education, which is good. It's hard. Like, chiropractic school is not easy. It's 4 years after an undergrad. It's hard, but it's nowhere comparable to medical school or DO school. Let's just call a spade a spade. That doesn't mean there aren't smart chiropractors that know how to treat and stay in their lane and that understand basic science as well. But on the social media front, sometimes just being anti-medicine becomes an identity, and they get a lot of followers, or they can sell supplements or things like that. So chiropractic obviously has its place. It's been fantastic to me and my family. I've been able to help a ton of people. But a lot of that has to do with just sort of staying in my lane and treating what I'm good at and what I'm capable of being good at. And luckily with me, like, when I got into practice, I actually worked in a family medical practice for the first couple of years. So I was able to like learn about a lot about meds from pharma reps, from nurse practitioners, from physicians. So that really helped me a lot. I think I actually worked in a hospital system too in Ohio with a sports medicine position. So anyway, it's kind of a neither here or there rant, but I know people, those are the kind of posts that go viral when people are like, chiropractors are doctors or physicians too. And that's like sort of true. Like, chiropractors can do DOT physicals, they can do physical exams for schools and things like that. And if you look at CMS, they do consider them limited physicians. But they're pretty far down. Let's call a spade a spade. They're pretty far down the tier as far as physicians go. Like, I would, a podiatrist is higher up that tier as far as a physician. A dentist is higher up as far as a physician. Sort of on the, while nurse practitioners might get a little bit less education, like, what they do is more medicine than what chiropractors do. So they're closer to a doctor than a chiropractor is. So, like I said, chiropractors are sort of like next to or analogous to OT, PT, and like athletic training actually is probably more in the realm of where they sort of fit into the healthcare system, if they do. So I know there's a chiropractic school at the University of Pittsburgh. Dr. Schneider has opened it. So hopefully that school will get better students. The chiropractors there will be able to go to school with and work next to physical therapists and physicians during their education. And I think it'll be better. I think you'll get more EBM care, by and large. So I think that'll benefit both the patients and the clinicians. And I think it'll help the doctors and PTs understand what chiropractors do and how and when to refer to them as well. So I think that holds a lot of value also. So yeah, I'm finishing I'm in second year now, so I still have one more semester before I take steps. So far, like, St. James has been awesome. Like, the education's fantastic, especially like this semester. Sometimes with these Caribbean schools, like, the biggest impediment is how thick the accents are for the professors. So, it just depends on who or where they're from. Like, we do get a lot of professors from like India, Russia, Ukraine, who are all like supremely educated. But sometimes there's some communication issues. But all my professors this semester, I like had no problem understanding. They go at a good pace. I'm currently taking pathology, microbiology, behavior sciences, clinical correlations of basic sciences, and epidemiology. So doing pretty well right now. I think right now I have A's in all 5 classes, about 3 weeks left of class. Unfortunately, the way finals go, our finals are with 40% of our grades. So just balancing all those, I'm almost certainly going to, I think, end up losing 2 or 3 of those. So hopefully I'll still, be able to carry a pretty high GPA and hopefully make the dean's list again this semester. But, time will tell. Things don't always go your way, and, life happens. So, but all in all, like I said, I'm handling this semester really well. I'm starting to prep for USMLE STEP. So luckily at our school too, like in the tuition, we get an AMBOSS membership. So there's multiple choice questions you can start practicing on. Yeah, the school's been really supportive. We just had our accreditation meeting again. So if you guys don't know, St. James, it's accredited by what's called the ACCM. So it's an accreditation body. And then they do a bunch of other bigger schools in the Caribbean too, like AUC and a few others. So that's like pretty important for getting your ECFMG certification and being able to sit for STEP and being eligible to enter the match to try to become a resident. So if you didn't notice this year, like the match data just came out on Friday. So EM picked up a lot. So a lot of IMGs are going towards EM because they know there's slots available. So EM is emergency medicine. Same with pediatrics. So there's still a ton of open spots in family medicine, which international medical graduates are going towards. And I know St. James, I think every single one of their USMLE counselors matched right away. You can kind of go to their Instagram page. They post all their success stories. So everybody that's matching in, that sends them their information, they tend to post there. So you can see kind of who's matching, who isn't. And they do have the list of their match success on their website. So if you go over to sjsm.org, you can go to I think it's called Graduate Success. If you go down there, they have all their matches for the last 4 or 5 years listed, and it'll tell you what specialty and what state they're going to. So they've been getting between 82 and I think 95% of their match applicants each year, and by and large, the majority of them are matching internal medicine and family medicine. So that's useful to know, so you have an idea of what career path you're going to be looking at. There's definitely quite a few pathology matches as well. There's some neurology. I know the school's matched a couple anesthesiology. They're matching quite a few general surgeons out of there. Some psychiatry. I know one person that matched OBGYN from St. James. So they're getting really good success rates. And that's, this is kind of the last chance if you want to end up going to med school or being a doctor. So to know that those graduates are having success and they're getting into certain specialties is really comforting, because the upside, of course, of St. James is the tuition cost. It's so much cheaper than most of the other Caribbean schools. Who knows how long it'll stay like that? So if you guys are interested, you should probably lock in right away and get involved with the school, because I'm sure as their success continues to grow, the tuition is going to end up going up. But as of now, it's by far the most cost-effective med school in the Caribbean. And I'd mentioned it previously, for somebody like me who's been in healthcare for a long time, they're a little bit more flexible with some of their prereqs, so they were able to accept my biochem and my organic chemistry and my physics that I'd taken. Like I said, I'm gonna be 42 coming up. Back in the mid 2000s, where a lot of the U.S. med schools would make me have to retake those classes again, even though I got A's in them the first time. So that was a big deciding factor of working with St. James. Is their admissions team is very flexible. They'll kind of work with you. I know a couple of my friends had to take a couple of classes from them, but by and large, I was able to find a school right away that was supporting me in that mission, and that's been pretty cool. And I had to take a break for a little while. We had some health issues, so I'm not in my original class, but in the class I'm in right now, I end up getting the highest score on the quizzes or exams about 85% of the time. There's occasionally times when I get beat, but I'm having a lot of success. So obviously I think I do well in school. I've got 6 college degrees already, but I think my previous education has definitely given me a leg up on some of the other students. But there's a ton of us that are in second careers in my class too. There's somebody that worked on vaccines for Pfizer. We have a nurse practitioner. We have a physician's assistant. We have a massage therapist. We have a couple people that worked in the ER. We have a pathology assistant. We have a pharmacist. We have a lot of healthcare people in their class. So there are a lot of people with different strengths. And so I'm a chiropractic neurologist. So they're like in neuroscience, I'm gonna have a big advantage. In musculoskeletal, I have a big advantage. I mean, I have taken path before, so I'm doing well. And same with microbiology. And being a biology major in undergrad, I definitely have a leg up at some of those. And then there's classes like behavioral sciences where I'm like, it's much more subjective. And I think we have a therapist in there too, so she's killing it. Um, so it's interesting how everybody sort of has different strengths in different classes. So that's been kind of cool. And we're a small class, so it's nice. We all help each other out. We provide resources to each other. We're not like in competition, like hardcore competition. Obviously, we all want to score the best, but we're not like hogging resources from each other. And like we are all genuinely cheering for each other because we want every single one of these people in our class to pass comp and pass step and get into clinicals. It'd be really cool if we ended up having like 100% graduation rate and match rate from our class. Like that's something we're sort of striving for. So we're trying to help some of the guys that are struggling a little bit, giving them some resources. Um, yeah, and like I mentioned previously, SJSM has like really good scholarship situations. So if you're a previous healthcare provider, there's scholarships for those. Like you get money for that. If you have over a 3.6 undergrad, you get scholarship money for that. The big one they have is your MCAT score. So if you have, I think, a 510 on your MCAT, you get a full ride scholarship. So you basically have no debt from med school. So particularly if you're like looking to get into family medicine, pediatrics, internal medicine, and you score well on your MCAT, like being able to become a doctor and not have any student loan debt is like crucial, especially if you're going to be going into a more moderate paying specialty. Like those that, they're not the highest paying, they're not surgical specialties. So if you're going into that, you're able to come out with like a lot less student loan debt. Like that's crucial. That makes a huge difference for people. Being able to move on with their lives and buy a house and have a family. And at the end of the day, no matter what people say about like declining payment in medicine or lack of autonomy, there's no clearer path to the upper class in the United States than being a physician. Like there's no jobs that are guaranteed the kind of revenue and earning potential that medicine provides. And you're going to get obviously some social prestige with that, and it's a job where you can genuinely help people. Like they literally save people's lives every single day. They're helping people navigate the healthcare system. In my opinion, I think it's still the best job out there, other than being a YouTuber. For most people, like in chiropractic, most people don't make any money, and like a lot of them fail out and end up having to go do other things. Like that doesn't really happen in medicine because there's guaranteed salaries. Like in chiropractic, you also have to be good at business. Like it's not something people just know how to do. Like in my case, luckily, like my parents are business owners, my grandparents are business owners, so I sort of had a built-in framework of people to rely on and talk to about how to grow a business, like which lawyers to talk to, how to set up your business structures. Like most people don't have that, So luckily, I was advantaged with that. In medicine, you can do that. A lot of people don't, but you can. But there's good attending salary jobs out there for people, and that's a big upside for it. So yeah, I mean, so far I've been really happy with St. James. Like the management's like super helpful. They always communicate. It's such a small school. It's really easy to get a hold of the deans. Like just this last week, like I had a question about grading, and I emailed the dean the night before, and he was able to get me in for office hours that next morning. So I can't think of another school where I've like had that kind of accessibility to like leadership. And we have a really good contact with our student government and our student liaisons. So, I mean, like I said, everything's bound to potentially change in the future, but like so far, I'm really excited and happy with my decision. I think St. James is like, I'm so happy I came across them because it's like one of the best decisions I've made as far as like picking educational pathways, like a school that really supports you, that provides all the resources you need, that's really affordable, and then on top of that, like you get to go to the beach and you get to see other cultures and things like that. So that's like definitely an upside. So if you guys are following me on like TikTok or things like that, I definitely have some posts about that. I posted my last MDME scores. So I've scored 87% raw on neuroscience, 83% raw on biochemistry, and 74% raw on physiology. So that was like the highest score in my class, all three. And all three were 10 points higher than the national average from US medical students. So I'm obviously getting the curriculum and getting the education, or you wouldn't be scoring that high. on those exams. Those are standardized exams. So the school is obviously educating us and getting us what we need to get done. Um, and obviously in this short-term goal, like the small space is going to be to pass the comp. So the comp is a comprehensive examination we take at the end of MD5. And after that exam, you have to pass it. You have to score, I can't remember what the marker is. And then you'll be allowed to take step one. And so then once you pass step one, then you go into clinicals. So that's sort of the short-term goal, is to get this basic sciences done, get through these kind of tedious classes like biochemistry and histology and things like that aren't super clinically relevant, but you have to know to become a doctor. And then you get into your clinicals, and we get to do all those rotations and kind of figure out which specialties we really lean towards, and actually start learning how to be a doctor and taking care of patients and acute settings and seeing real disease. Because right now we're book nerds, right? So yeah, I know, like I said, multiple people that I know personally have matched out of St. James. That was sort of the thing I checked first. Like I talked to a bunch of people that were graduated from, and asked them what their experiences were and how they were able to match in, and they were able to communicate with me. And so that was kind of the thing that made me go, okay, I'm going to go ahead and do this. So solid school, super, super happy so far. Can't say enough good things about the upper management staff. It's been pretty cool. Hey Shane, what's going on, man? I was gonna go to Parker. That's where I went. I went to Parker. Parker's doing some cool things. Dr. Andy Galpin is working with them now. I know that at Parker Seminar they just had a bunch of big names. Um, yeah, it's in the States. The only downside I think at this point is just uh, the tuition to income ratio. It's just that everything else in this economy, the inflation has just gotten so out of control. Um, I think tuition's almost double when I went, and the cost of living is also much, much higher. But every generation says this, right? They're like, oh, I wouldn't do it again, but then we all do, and we all become successful. So take that with a grain of salt. People were telling me the same thing back in 2010 or 8 or whatever, because it was so much cheaper in 2003. And I went through and got through and paid off all my debt. Um, yeah, coming from Hawaii, Dallas will definitely be cheaper for sure. Um, but yeah, when I was there, I think I was paying $300 a month for my room in a nice 2-bedroom apartment, which is just insane to think about now. Um, but there's options. Dallas Metro is big. You just don't want to be that far away from school. Um, and I think they've even changed the education. I think it's partly hybrid now too. I don't know. I haven't kept up with it that much. I used to be on the board of directors for the Alumni Association for Parker. I was the vice president for a couple years. I was on the board for 6 or 7 years before I got involved with SUNM. Um, but yeah, for me, it was just I felt like I maxed out what I could do with that degree, and so that's why I started tilting towards medicine more. I want to do, yeah, I want to do injections. I want to do PRP and stuff with nerves and um, obviously I have my neuroscience diploma. I haven't gotten my score back for my fellowship, but I know clinical neuroscience. I just don't find a lot of it to be all that clinically applicable, especially in my business structure and model. I think if you want to do functional neurology, you have to set up your whole practice around that, and that's just not. I haven't seen enough big time results from that to feel like I feel comfortable in that. And obviously, we end up doing what we're good at, and so for me, that's treating musculoskeletal pain. So I think that education helps me to identify zebras, right? Those crazy cases and get them referred out. And I think my neuro exam is way better, obviously, than the average chiropractor because of that education. But I just, I've lost some of the challenge in the field. I know my limitations at this point. There's not new ways that I can fix certain type of injuries. I think I've mostly maxed it out. And so the only way forward, in my opinion, is just to go into medicine. So, um, yeah, and DO schools are crazy expensive. The one here in New Mexico is almost 70,000 a year. So most of the schools they tell you to estimate spending $100,000 a year, and most of those are going to be grad plus loans at 8 point something percent. So if you're going to go that route, you need to match into a very high paying specialty to be able to get out of that burden of debt. Um, Whereas, Parker's significantly less than that. I think it's like 40,000 a year maybe or something like that. Um, and then, St. James is right now it's $27,000 a year. And then the living expenses in St. Vincent are obviously much cheaper. But you have to move your family or whoever to an island, and that's not doable for everybody. Although I have a chiropractor friend down there right now, and he's a little older than me. He's 54, I think. So his kids are already grown, and his wife is still in the States kind of working. So they kind of agreed to split, or not split, but like, she didn't go to the island with him. And he's got about 5 months left. So he's going to be going back to the States. And then they'll go into clinicals. So some people do make that work. Like for me and my wife, we don't even travel apart. So that's like not our thing. Like a lot of other people, it depends on their relationship situation. Like for us, that's not really an option. Um, and so luckily she was down and she's like, yeah, let's go to the Caribbean. Let's do it. Let's do an adventure. Um, so yeah, it's been a pretty good situation from that perspective. Um, yeah, and who knows? Like I say that's what I want to do now, and then I may get into clinicals, and I just like may just like I obviously like neurology, so I'm not ruling neurology out. Like I may just fall in love with like conventional neurology. I mean, who knows? Like who knows? You know, there's other stuff that may you may just fall in love with when you get into clinicals, but as of now, yeah, I mean, you can go a bunch of different ways. If I want to just do regenerative, I could even go into, I could just do family and I could do concierge service. PMR is obviously a cool field. The thing about PMR is like, there's nice salaries, and then there's even fellowships where you can really make a lot of money. Like, I've got a buddy who just did a spine fellowship, and he's basically making back surgery money, like 800 to $1 million a year. I'm just doing procedures. Shane said, "What are your thoughts on Dr. Carrick's work or having sportsman performance?" Yeah, I was talking about that earlier. Obviously, I've got 400 hours of Carrick Institute. I used to actually do a little bit of teaching with them, just for a short period of time. And yeah, I mean, it's cool. There's definitely use for it. It doesn't fit my practice all that well, to be honest. Like I said, some of it takes a lot longer. Like you having people with like really long-term programs and things of that nature. But I mean, Ted's a genius, and most of the instructors are brilliant too. They're definitely the smartest chiropractors, like the neuro guys for sure. Um, Unfortunately, what they do almost doesn't even fit chiropractic to a certain extent. Like they're almost like too advanced for like the field, if that makes any sense. But they are also somewhat limited by their scope. I know for a fact, like a lot of them ended up getting their nurse practitioner degrees also because they wanted to work meds in with their functional neurology work. They wanted to be able to do like Botox shots on the spastic muscles and things of that nature, and they wanted to help be able to like manage migraines and types of dizziness and things of that nature. So a lot of them don't. A lot of them just stick with purely receptor-based module therapies and things of that nature. Um, but it varies. Yeah, Dr. Brock was one of my neuro professors back in the day. Cool dude. He just got his third doctorate, I think. Smart guy, super smart guy. And him and Ted used to be like super best friends. I think they've kind of gone their separate ways philosophically, but Ted's teaching at a medical school, I think now as well. Um, yeah, like I've done 400 something hours of the program. I'm a diplomat. I'm a chiropractic neurologist myself. Um, I took the fellowship exam as well. So obviously I enjoy it. It's fun for me too. Um, has it brought any revenue to my practice? Nah. Do I implement it very often? Not really. And because I don't implement it that often, I think just like any skill set, like you have to do it often to be good at it. I definitely think a lot of it has merit. It just doesn't fit into my practice strategy. Like I said, I think if you're going to do that, like it almost has to be like a boutique functional neurology practice. Um, the only downside to that is you don't know until you're in it. So spending 3 years at chiropractic school and doing 3 years of a postdoc and then not knowing if that business model works for you or your community, if the people have the funds to pay, because it's usually not covered by insurance. Or if you're going to get the outcomes you want, is a little risky, and you don't have a lot of other backup plans from that perspective. Like if you become a nurse practitioner, you can always just go back to doing other stuff. And same thing with medicine. Obviously, medicine's harder because you have to do a residency, um, and obviously school's harder than both. But yeah, it's a path forward. It's definitely a thing. And obviously, you don't have to leave the country when that's the case. But like um, for like all my fellow students, and there's a ton of chiropractors that go to St. James. I know like five, I think, that have gone through the program. There's three of us right now in the program. Um, so a lot of them, same thing. They get frustrated. A lot of them like to do nutrition, so they do nutrinomics and genomics, and they just again end up getting like they run into the limitations of what they can do. So medicine allows them to expand that, and obviously there's better insurance billing. So the stuff that they can do, they can actually get paid for. People's insurance will pay for it. Um, so I know that's a big reason why a lot of chiropractors end up doing that. The other thing too is a lot of us, it's a very physical job being a chiropractor, and a lot of us wonder what our lifespan of that career is going to look like. Are we going to be able to do that till we're 65 or 70? And the answer is unknown at this point. And some do, but like I'm a very soft tissue heavy person, and I've done it for 15 years. I'm fine now, but will I be fine in 15 years? I'm not sure. So having another scope of practice that I know that I can fall back on, I think is a big thing for me. And like what I'm really interested in is osteopathic neuromusculoskeletal. So that obviously neurology and PMR are sort of like in the wheelhouse of the things that I'm looking at, because I believe obviously in manual therapy, and I believe in I definitely believe in like osteopathic tenants. That's huge for me. But obviously allopathic medicine has its place and helps a lot. So um, how would I compare chiro adjusting and OMT? Well, OMT learns HVLA, but they also learn a lot more techniques. They learn like more soft tissue stuff that I think is better. Like they learn fascial distortion model. They learn strain counter strain. Some of it I don't use as much, like Chapman points and some stuff like that. They also, like I said, they're full physicians, so they kind of learn everything. But chiropractors, most of the schools really lock in on HVLA, which is the high velocity, low amplitude. I mean, there's sort of like, the truth be told, D.D. Palmer stole his ideas from AT Still. So of course chiropractic is going to look like osteopathic. They've gone through somewhat of similar plights as far as like professional growth and discrimination and things of that nature. But yeah, I mean, I agree. I think DOs sort of have the best of both worlds if they're into manual therapy. The only downside, of course, is that like the education is extremely expensive for most of them, and that sort of prohibits them from focusing in on that kind of stuff. There are some that do it, obviously, but it's a very small minority of people that go into osteopathic for osteopathic philosophy and treatment. I know a bunch of them. They're really awesome. Like they're honestly the best doctors. The fact that like they can be actual doctors, but also they have an osteopathic philosophy and way of looking at things, like they're the best, especially for like primary care and like musculoskeletal consultations. They just get it, super awesome. Whereas like a lot of my MD friends, it's like speaking a foreign language to them. Like I said, PTs usually kind of get it too, especially if they're outpatient ortho. But yeah, like the field has been really good for me. Shane, I don't know if you were on here earlier. Like the thing about being a chiro is there's not a lot of good salary jobs. That's the hard thing. Like you almost have to be an entrepreneur, and not everybody's made for that, and not everybody has the background in it. Like I said, for me, my parents are entrepreneurs. They own businesses. That's what I was used to. My grandparents own businesses as well. So like I had those people to lean on and talk to their accountants and talk to their attorneys. Where if you grow up and your parents weren't doing that, they were like teachers or something, like you just don't have that like free person that you can go and talk to about like, what lawyer should I get for this complicated business? What should I do for this? And so you have to know that going into chiropractic is like you're going to have to figure out how to be an entrepreneur and a healthcare provider. And like the odds of being good at both is just, it's not that high, it's tough. You have to be, you're also sort of a salesperson in chiropractic too, right? Like people don't have to have that care. So you have to convince them either through your work or be able to talk to them that there's value in it. You know, when you're a doctor, like people need doctors. Like you don't have to tell them that. Same with dentistry, right? Like you don't have to tell them that. You don't have to show them that. And that's where a lot of my colleagues that have ended up leading the field and gone to other professions, a lot of them have run into that issue. They were very ethical, wanted to do short treatment plans, or maybe weren't that outgoing, and it's just hard for them to make a good enough living for the amount of debt that they picked up. To make 50 grand a year when you owe 200,000, 300,000, it doesn't make sense. So a lot of them ended up becoming farm reps or like going into the oil industry. Obviously, a lot of the female chiropractors I went to school with ended up being, part-time, but mostly stay-at-home moms. And you'll find if you end up finishing the program, like 30% of your class will end up not practicing within 5 to 10 years, which is not something you can say with medicine because there's jobs, like there's job security. So those are the things you sort of have to weigh. It's. I think people overestimate their business savvy and skills. They just assume they'll figure it out, but almost all businesses fail. So now to that extent, I think just really honing your skills and being a really good clinician and getting outcomes is the key. Because your results will sell themselves. But it's still not easy. You still have to be able to deal with staff and manage staff and negotiate leases and contracts. And there's just a lot that goes into it, making sure all your numbers make sense. Like that you're not overpaying for EMR and things of that nature. Is there a restriction in how you want to practice being in the medical model? No, I don't think so. I have a fairly allopathic mindset, to be honest. I respect chiropractic philosophy and osteopathic philosophy both, but like I'm pretty mechanistic, to be honest. Like, so, yeah, that's kind of where I'm heading with it. Yeah, and we'll see. Like, listen, Caribbean school, it's not a guarantee either. Like, there's a good amount of students that enter these programs that might not be able to handle it. It's a lot harder than chiropractic school. They're really not even close, to be honest. The education isn't all that close. And then even if you get through all that, you still have to match, and it's not easy to match as a Caribbean graduate. So you have to network, you have to talk to folks, you have to get out there in the community, you have to be able to make program directors think that you have value that you can bring to their program. That you have some clinical experience, that you can deal with patients, that you're an asset and not a liability for them. So like I still have a lot of hurdles I got to get through. Let's just see if I can pass step 1 first. Like I'm pretty confident in it, but like a lot of people don't, and I'm older, like my brain is like decaying on me a little bit, obviously. When is the CTE door going to kick in? Like who knows? Billing for your manual therapy, all the ortho stuff you do while being an MD now, is that billable? Oh yeah, it's billable. So I have a friend who was a chiropractor. He went to DO school. And he kind of practices like a chiropractor still, but like he bills full medical exam codes because he's a doctor and he's doing those things and he's doing manual therapy and he gets paid a lot more per intervention. So I think he either tripled or quadrupled his revenue doing the same work as a DO as opposed to a DC. But obviously he had to go to 4 years of med school and he had to do 3 years of residency before he could do that. So you have to kind of weigh the numbers out. Like, I think he was making like 200 grand before, and now he makes like 800 grand doing sort of the same thing. Which is probably a no-brainer, right? Like say you pick up 300 grand, 400 grand in student loan debt, but you're making $600,000 more a year right off the bat. Like that pays for itself like that, like instantaneously. And I think he's doing some injections too. He's doing some paraneural therapy and things like that, which are not covered by insurance. So those are cash paid, but like they're quick, some Botox, things of that nature. But yeah, that's something people do. I don't plan on doing that necessarily. Like I'm not really interested in that idea, but like as far as like work-life balance, like because the thing is the chiropractor that has already been in practice, and if he was successful in practice, he knows how to run a clinic. So now that he has a better license with better insurance practices, if he goes back and does the exact same thing, he'll be more successful. And if insurance is paying well and people's copays are lower, instead of the patient having to reach in their pocket and pay $150, they're reaching in their pocket and paying a $30 copay. They're happier with that. They're coming back more frequently potentially. and you're getting more referrals for it because they're not having to squeeze their butthole so hard on, paying more out of pocket for each intervention or each treatment. So that is an option that exists for some folks as well. So I do know some folks that have done that. Like I said, I'm not necessarily looking to do that. Like, luckily, I've been successful enough through YouTube, particularly, and Facebook, to where my finances are pretty good. Obviously, I'm a little young to retire, but like I don't need to go grind for a big bag at this point. Like, my investments are pretty solid, which is allowing me to do this sort of passion project of going to medicine and learning more about the body. Picking up my third doctorate. But that option exists for people. So that's a thing. So yeah, I think that's all I got for today. So guys, if you guys are watching this later on, drop some comments below. Let me know if you have any other questions about like differences between chiro school and med school, or like the board exams, or how I'm prepping, or if you guys have questions on like how I'm doing this at my age, if I have any like tricks, because like obviously I went to school and I grew up in an era that's a little technologically less advanced than it is now. So I'm trying to pick up this stuff from the kids, but it's definitely a challenge. What else? Yeah, if you guys have any questions about like, like what the student life is, or things like that, like go ahead and drop some comments below and I'll jump on here. I'm trying to do a couple of these a month. Just because I get a lot of DMs of people asking me about like how med school is going, or like what it's like compared to chiropractic school, or things of that nature. So like, instead of just trying to get in the DMs and responding to people, I think just jumping on here and getting it out there publicly is probably a better use of both of our times. Nosferatu says, "What are your thoughts on the ring dinger?" Worked really well on me. So Dr. Johnson sent me a table. I use it sometimes. I think it's a pretty solid technique if you're using it for the right things, which, for me is like lumbosacral fixations, primarily, like stuff that you can't get to with other stuff. I know a lot of people hate on it, but like, to be honest, like he was able to fix some stuff in my neck that no other chiropractor or PT could. I think he gets a lot of hate because of how the technique looks, and because, maybe people don't like his Southern accent, but honestly, he's been like a huge asset to the profession. And even chiropractors like hate on him. Like I see it all the time. But as far as I know, he's never had a malpractice lawsuit. Like he's never had a board action against him. He's been doing this for longer than I've been alive. I think he's been a chiropractor for 45 years. And like I said, personally, he helped me. He fixed some things that nobody else could. So I have nothing but respect for Dr. Johnson. And I know like a lot of other guys have like gotten like pretty big doing the ring dinger. I know that they are working with, I think, Texas Chiropractic College, I think now. So getting it into the curriculum a little bit. Don't quote me on that. That's just what I have heard. So I think it will be involved somewhat in the chiropractic profession in the future. But yeah, with any change, there's resistance, right? Like you come up with a new technique, people are going to hate on you. And I think that's what we're experiencing with him. It just looks different than what people have seen or done before. But like, to be honest, like it helped me a lot. So nothing but great thing. Like he's a great dude. I love Dr. Johnson, man. He's such a nice guy, caring guy. His wife's amazing. I've been able to go down there and visit with them 2 or 3 times. Nothing but good things to say about Dr. Gregory Johnson. Just fantastic. Yeah, good people, man. Good people. Is that adjustment for everybody? No, nothing's for everybody. But like for me, it really helped, and it's helped me help a lot of patients. And I know a ton of people that have gone to him have gotten really fantastic results. So yeah, cool dude. Cool. Well, I'll publish this up there. I'll probably chop up a couple of these segments, maybe post them as well. And I'll try to jump on here maybe in 2 weeks or something like that. I have finals coming up, so I probably will be locked in and studying quite a bit. I just had 2 quizzes this week, so next week I don't have any. So I was like, this is a good time. Let me jump on. But like, drop some comments below if you guys want me to cover any other topics, specifically any questions. I can do personal questions too. Obviously, primarily I'm doing these about med school, about my med school experience, about St. James. And if you guys are interested, like I said, I'll link it below, sjsm.org. Check it out. And if you guys, yeah, if you're in chiro school or whatever, make sure to check out Parker seminars. And yeah, I'll catch you guys on the next one.